Okay.
Okay.
Ready?
LW, a 20-year-old college student, comes to the University Health Clinic for a pregnancy test. She has been sexually active with a boyfriend of 6 months, and her menstrual period is now a few weeks late. Pregnancy test result is positive. The patient begins to cry, saying, "I don't know what to do." How will you begin to counsel her?
So you're going to look on page 224 for assessing maternal response. You're looking at uncertainty, ambivalence, those types of things. And then on page 248, you're looking at the psychosocial assessment.
And what info do you need to obtain from her and why?
On page 224 to 225, you're looking at her OB history, medical surgical history, stuff like that. And then page 248, you're looking again at the psychosocial assessment.
And what options does a woman experiencing a pregnancy have?
That's on page 704, and it looks at the different options for elective termination. And then on page 515, adoption.
If your role is to assist her in making a choice, what information will you want the patient to provide?
So you're going to be looking on page 25 for the nurse's role, along with, once again, page 248, table 13.7, psychosocial assessment step.
What are the nurse's moral and ethical obligations in this situation?
Page 11 and page 12.
LW asks you to tell her about abortion. What will you tell her?
You're going to be looking on page 704 at different types of abortion techniques.
You tell her there are two types of abortions, vacuum aspiration and medical abortion. How would you explain the differences to her?
This is also on page 704, and you'll look at the two different types of techniques.
What are the contraindications of using Mifeprex for medical abortion?
This is also on page 704.
She tells you that she has heard that if a woman has an abortion, she might not be able to get pregnant again. How would you counsel her?
You're going to be looking at pages 676 and 677, and you're also going to be looking at pages 704.
Patient asks you, do you think abortion is killing? What is your best response? You have 4 choices there. You should pick the most therapeutic one.
We based it off of what we found on page 12.
Yes. And what types of emotional reactions do women experience after an abortion?
You can find this on page 525.
Patient wants to know about adoption. What will you tell her?
Once again, on page 515, and you're just going to be looking at ways to therapeutically communicate with her about her option for this.
You ask the patient if her boyfriend is aware of the possibility she was pregnant. She tells you that she did not tell him about her period being late or her visit to the clinic today. She asks you if she should tell him because she is afraid he will freak out. How should you respond?
So page 240 to 241 is looking at the father's paternal adoption. Yeah.
Are you concerned about the term, she is afraid he will freak out?
Yeah, I was thinking maybe we should also look in the violence chapter, which is
so interpersonal.
Yeah, assessing her home life and seeing if she's had issues in the past with him. Because, I mean, anybody will freak out, you know, so I would be thinking, before coming to conclusions, of just assessing what her relationship is like.
Figure out what freak out means.
Yeah.
Patient says she is uncertain as to what to do and wants to know how long she has to decide. How will you respond?
On page 704, and then you're just educating on time frames. Like, there's certain time frames that you need to look at for the different abortion types. If that's what she chooses to do, she has a selected time frame for that.
She declines an examination and says she needs to think about all this. She does make an appointment to return in 1 week. What teaching do you need to provide her about how to take care of herself in the meantime, and how will you respond?
So a lot of this, there's a lot of page numbers, so just really review chapter 13, specifically teaching discomforts, page 230, teach what to expect, like importance of taking prenatals and maintaining prenatal care if she chooses to keep the child. reporting complications, which is on page 236. And then page 17 and 18 just talks about refusal of care. Just in case she doesn't come back, you want to make sure that you're covered. And yeah.
That's it.
That's it.
Y'all come back now, you hear?
Bye. See ya.